What's up, everybody? You are listening to the Strength and Knowledge Podcast. I'm Dr. Zach Baker, and I have with me Dr. Corrie Jones, Director of Clinical Excellence at Rehab to Perform. And Corrie, we're going to keep it easy today. I have got one question for you, and this question is, what has been the biggest realization that you've had in your career as a physical therapist?
Yeah, I mean, when you go to school for your doctorate, you think that the biggest thing you need in your career is all of the science and all of the practicality of what you're doing. And granted, you need that for sure. But I would say my biggest realization is how much of our profession is actually really based in social IQ. By that, I mean how you're communicating with people, how you're reading people, how you're talking to people, how you're motivating people. It's really interesting because very, very little in school do we talk about the psych-soc side of physical therapy. And yet I would say that the tools that I've had to develop over the last 10 years are primarily driven towards some of those types of things. I have successful patient courses of care when I do well at those things. Some of the ones that might be a little tougher are maybe where I haven't done as well with that side of things. So it's interesting that you say that because it's literally expectations that I'm presenting with the patient. Do they know what therapy is going to look like? If they have fears, anxieties, all of that, how am I addressing that? What's the best strategy? Because guess what? That's going to be different for every single person. So individualizing care, not only on the science side of things, but also on that social, psychological side of things, where I have to know the person in front of me and I have to consider what's going to be best for them. Even when we get into exercise and loading and everything, my decisions clinically for how much load I give them might be tied to how they feel on that day, might be tied to their confidence, might be tied to their sport. Really some things that I really have to dive into in knowing a person in front of me. And even to reflect on that, maybe it's a little bit of gaining trust as well, trust and buy-in. Those things, in order to have somebody and be able to guide somebody in a course of care, they need to be able to trust you. And they need to feel that you're competent. They need to feel that you're confident, and they need to feel that you care. So if those are the big things, I think school and mentorship and stuff like that teaches you the competence side of things. But we have a responsibility to learn how to care for people and how to really show concern and individualize stuff based on who they are. So I would say that would be my biggest revelation, was how influential that social IQ side of things would be to actually helping people reach their goals in physical therapy.
And that's not far off from where my mind was with the biggest realization I've had. And I'll almost reframe what you just said is I've come to the realization that I am more of a facilitator as opposed to a healer. And same thing, coming out of school, I was very black and white in my mindset of a patient comes in, you identify the problem, you give them a diagnosis, and then you give them the solution to the problem and you fix them. Here's what's broken. Here's what we're going to do. You are now fixed. My job is complete. Then I started realizing, not everybody presents like they do in a textbook. Not everybody responds to the treatments you give them. Not everybody does the treatments that you ask them to do. So it's funny. I almost find myself now, I feel more like a project manager as opposed to a physical therapist. And like somebody's coming in and the project is their knee pain. And then your role is figuring out, all right, well, these are all the things from a medical standpoint that are contributing to your knee pain. You know, here's the mechanism of injury. Here is the likely tissue or bone or anatomical structure that was involved. Here's other medical comorbidities that are contributing to it. Now that we've had this injury, these are the impairments that have come out. But guess what? There's other things happening. There's life that's happening. There's social things that are happening. There is the patient's perspective or buy-in or how much they want to be there or think this is going to help. There's the logistics of the situation. And maybe you have great buy-in, but this person is not only working, they're also in school. And they're in school all day and they work at night. So their ability to come in and follow this brilliant plan of care that you have, it's just not going to work. So it's funny. I just started like last year kind of thinking about this because I was actually talking with one of my patients in construction who was coming in for neck pain, and we were kind of triaging what his options were, the pros and cons of PT versus getting an injection. When do we make the delineation that conservative management's no longer going to work and we may entertain surgery? How are we going to come to that decision? And it was funny. He was like, Zach, this is like when I'm having meetings with my staff, and I'm a general contractor, and I've got my 5 different departments and trades that I'm working with, and we're trying to figure out how do we get all this to go together. And it was kind of funny. We started to realize like we do very, very similar things. Just mine has to do with people and their body, and his had to do with building commercial real estate and all the different parts and pieces that go into that. So it's funny that you brought that up. For anybody who is listening that's trying to figure out like, how do I integrate this approach? What types of thoughts or what are things that you would just encourage them to do as they start to hit this realization in their career as well, whether it's the first day on the job or 10 years into it?
I mean, one of the things I would say that helped me is reading. So I do a heck of a lot of reading, not just in the PT world, but in the social sciences world and in the psychological world. Reading is just how I learn. So if that's a way that you learn, that is so helpful. There is so much research out there, but also just books on how you interact with people and how you talk to people. And just kind of figuring out how to work in a service profession. So reading might be the number one thing I would say. But then also the biggest thing I would say is taking time to reflect. We are busy people. We have a busy caseload. Everybody's doing a whole lot, even after they go home. Some people have kids, some people have other jobs, some people are coaches. So obviously things get pretty busy. The best thing that you can do, though, is spend a smidge of time every week kind of reflecting on how things are going. What are your pain points? What are the things that stress you out? What are the things that seem to be getting in the way? Because a lot of times some of the frustration or feelings of anxiety or whatever at work are because we haven't taken the time to reflect and then come up with a plan. A lot of times, if we're talking about this revelation that these are people, we don't have to fix them, we just have to guide. A lot of times it's that I'm putting either too much pressure on myself to, quote, fix somebody, or I'm putting too much responsibility on the patient to, quote, fix themselves or to jump into something that they just don't have the bandwidth for. So the reflection period, if you just walk down through your schedule and you reflect how things are going, sometimes you can identify these are the things that are actually creating the anxiety that I'm feeling. And then you can start to take action on them. If you don't reflect, man, that anxiety just kind of lingers there and it kind of affects how you treat things. So really, really helpful for that time to just, I would say, read a lot, read wide, research a little bit. If you have a mentor, talk to mentors, talk to other people and see how they've handled some of this stuff or the revelations they've come to here, what's been successful for them. But again, self-reflection, self-awareness is a huge part of what we talk about actually in the sports residency. So being self-aware can really help you lead into some solutions.
Love it, Corrie. Thank you. And if you were listening to this episode and you enjoyed it, please share, like, and subscribe. You're listening to the Strength and Knowledge Podcast. I'm Dr. Zach Baker. This is Dr. Corrie Jones. Thanks for listening.